Hello New Skin family, Eddie here and this is Margaret. Today we are honored and excited with this opportunity to have an online interview session with a medical specialist from our Southeast Asia Children Heart Fund local partner, Institute Jantung Negara, IJN in Malaysia.
Hi, Dr. Marhisham. Please say hello to everyone. And can you please tell us more about yourself as well?
Hello everyone, my name is Dr. Marhisham Bin Che Mood, and I'm a consultant pediatric cardiologist and the head of a Paediatric and Congenital Heart Center, PCHC, of Institute Jantung Negara, IJN at Kuala Lumpur. I have been in IJN for 12 years and I started my career in IJN as a clinical fellow, completed my fellowship training and gazetted as a pediatric cardiologist since then. So I was appointed as a head of a PCHC since January 2020, and my vision is basically to consolidate the services provided by PCHC, working towards a subspecialization, emphasize more on holistic approach in medical care, including the social well-being of our patients.
Wow, that's very impressive. Now we know that Dr. Marhisham is with IJN for a long time, and you are definitely the right person to answer the questions that we have prepared for you.
Okay, allow me to start with the first question. We are aware that congenital heart disease could be detected since live birth. But what are the common signs and symptoms that a parent should pay extra attention on to ensure early detection and immediate treatment?
All right, thank you for the question. And some congenital heart defect can be detected at birth depending on the severity and also complexity of the defect. And most of the time, patient with a simple congenital heart defect has no significant symptoms and signs from the beginning of life until about a month of age if the hole is big or the congenital heart defect is significant. These symptoms include breathing difficulties, excessive sweating, interrupted feeding, or even poor weight gain or failure to thrive. And those with a complex congenital heart defect, they tend to be very sick and needing hospitalization. And they can have a bluish discoloration of the lips or fingers, and a lethargic, fast breathing or breathing difficulties, and may require intensive care therapy for stabilization.
Thanks for sharing about the signs and symptoms in detail. It will be pretty informative for all parents out there to take note and monitor their newborn baby from time to time.
Yes, agreed. As we were mentioning about congenital heart disease, I'm also curious about the common types of this disease found among the children and what are the treatments available for them.
Among the common congenital heart defect is a hole in the heart. So there are a few types of a hole in the heart, namely a ventricular septal defect. So this is the most common, atrial septal defect, and patent ductus arteriosus. So basically there's a defect in between the two chambers of the heart. And the option of treatment of this heart defect varies from open heart surgery, transcatheter device closure or non-surgical intervention, medical therapy, or even regular follow-up assessment, since some of these heart defect has potentially closed spontaneously.
I see. So, with the advanced medical technology that we have now, congenital heart disease is curable with early detection and surgery according to the doctor's consultation. Do stay calm if your child is diagnosed with the disease, and do quickly bring your child for proper treatment.
So besides that, I would also like to seek for some advice on the post-surgery home care. What would be the common do's and don'ts, especially after the child has completed each surgery or treatment, probably in terms of food intake and daily activities?
All right, I would really emphasize on hand hygiene and also prevention of any infections. This is the most important practice following a heart surgery. Because the child is very fragile, the immune system is somehow affected and prone to catch any infection. So most of the time, we encourage our patients to be off from school for at least 6 weeks to 2 months after a heart surgery. and they can always resume their activities after that. There is no specific food restriction for patients after surgery. However, they are encouraged to take healthy foods, some supplements, and compliance to their medications. In certain cases, they may need to restrict their fluid intake just for a while.
Thank you so much, Doctor, for sharing these home care guidelines. Last but not least, is there any tips for all pregnant ladies out there to know how to detect whether their baby have congenital heart disease, or what to do if they know that their baby has the risk of congenital heart disease during their pregnancy?
In the current era, the pregnant mother who are at risk, example, those with established diabetes mellitus during pregnancy, has a family history of congenital heart disease in a family, or on certain medications for their other illnesses, are encouraged to have fetal echocardiography screening. And this procedure is done as early as 16 weeks of a pregnancy and would be able to detect most of congenital heart disease in utero if there is any.
All right. We truly appreciate all the information shared by Dr. Marhisham, and I'm sure it has been a fulfilling session for both of us as well as for everyone who is watching this video. Would you mind sharing a final line of encouragement before we end today's Zoom call?
Learning about congenital heart disease can help create awareness to more families to have early detection, especially during pregnancy, and to observe their growing children and understand better on their children's condition. If you notice that your baby has any of the signs and symptoms above, do not hesitate to check with your healthcare provider as soon as possible.
Thank you, Dr. Marhisham, for being our special guest today despite your hectic schedule.
Thank you so much, New Skin Malaysia, for arranging today's session with Eddie and Margaret. And I'm very grateful with this opportunity to create more awareness program about congenital heart disease among Malaysians. See you. Bye-bye.
To all New Skin brand affiliates, we hope that this information will help you to understand more about the children from the underprivileged families that we've been helping with our 1% monthly commission. Please join us to create more smile in future.